Did you know there are 3 different classes of medication that treat ADHD? So there's stimulants, most people know that. There is norepinephrine reuptake inhibitors, and there is alpha-2 agonist. So in this video, we're going to talk about each of these classes, the different medications, how they work, and how they contribute to helping the symptoms, or alleviate the symptoms rather, of ADHD. So first, stimulant. So many people may have heard of like amphetamine or methylphenidate. These are drugs that help with kind of blocking the reuptake of dopamine and norepinephrine, and also kind of helps spur on that production. So someone is feeling more dopamine. Now, why this is helpful is dopamine is associated with motivation, attentiveness, interest. Norepinephrine is also associated with alertness. So by having this kind of float around and not vacuumed up as fast in our brain, we feel more of that. We feel more attentive. We feel more alert. Typically, these will work for a few hours unless it's extended release. Even then, it's maybe 8 to 10. And it is a stimulant. It increases heart rate. Then there are things like cognitive enhancer, which would be that norepinephrine reuptake. So something like antamoxetine or Strattera, that just works with the norepinephrine. So you don't get that side effect. You don't get kind of the racing heart, but you still get that alertness. Then there is SNRIs, which is also a norepinephrine reuptake inhibitor, but in this case, serotonin and norepinephrine reuptake inhibitor. So this would be something like Wellbutrin. So it's working to kind of help someone feel more serotonin and norepinephrine. So this is also an antidepressant. So this is prescribed for depression as well as ADHD. This is still in that norepinephrine reuptake inhibitor class, although different classes of drugs in some way. Then there is alpha-2 agonists. So this would be something like guanfacine. This is used also to treat high blood pressure. So if you have ADHD, you're like, well, I can't take a stimulant because that's going to make things worse. Well, no, you could actually take something that maybe helps with both the ADHD and the blood pressure. So there are options. If you are interested in any more topics like this, go ahead, please click like and subscribe. And if you're interested in any of this content as it relates to you, I encourage you to talk to your doctor about it. Thank you for your time.